Hi everybody, welcome to my channel, The Rated Nurse Nate. Today's video we're going to be talking about strokes. What is a stroke? Why does it happen? What are some signs and symptoms of a stroke? What does recovery look like? And what can you do to prevent a stroke? So according to the American Heart Association, 1 in 3 people do not know the signs of a stroke. Let's get to it. So first things first, my name is Nay. I am a nursing student. I have a few degrees in my background, but right now I currently am a nursing student. I have taken care of patients who were recovering from strokes. So I have seen kind of the process and how it can affect a person's just like daily life. Things first, I got my clipboard here. This is like my education training pack. So these are my resources that I use to gather all this information. It's totally available to you free on the internet. You have the American Heart Association, which is the heart.org. There's also the American Stroke Association, stroke.org. And then you can also go to the CDC website and type in stroke, and it has a bunch of good information and facts on there as well. What is a stroke? We call it stroke, general terms, but also in the hospital term, they call it a CVA, which is short for a cerebral vascular accident. So you can look at it as like an accident going on in the brain, something going on in the brain, an accident that shouldn't be happening. So basically a stroke has some type of blockage in your brain that's preventing your blood from flowing properly in your brain, preventing oxygen from going through your brain. And that's why you get some of those neuro symptoms with numbness and tingling, speech difficulties and things like that. For a stroke, for a healthy brain, this is a brain, let's just pretend, healthy brain, everything, let's act like that's not there. A healthy brain, act like this is a blood vessel in your brain. So if this is a blood vessel in your brain, everything is free from any clogs or any stopping or anything like that. It's just flowing. Your blood is flowing all over your brain like it should. You're getting oxygen, you're healthy, you're happy, everything's perfect. That's what's going on in a healthy brain. What happens in a stroke is you have some type of blockage. So I drew this right here. Act like this is some type of blockage in a blood vessel in your brain. And what it does is it stops oxygen, or delays oxygen from getting to certain places of your brain. What a stroke is. Let's talk about some risk factors for stroke, right? Because there are some risk factors. There are some things that are modifiable that you can do to change so that it lessens your chances of having a stroke. And then there are some things that are unmodifiable that it just kind of puts you at higher risk because you're in that category. So first one, non-modifiable risk factors for a stroke. Increasing age. It just kind of is what it is. The older that you get, the higher your chances are of increasing chances of getting a stroke. Family history and genetic disorders. If you have a family history of stroke, it just kind of puts you at a higher increased risk of developing a stroke yourself. Or if you have certain genetic disorders, it puts you at a higher increased risk of developing a stroke. Race. African Americans have higher incidences of strokes than Caucasians do. And that's just kind of a non-modifiable risk factor. Gender. Women have higher risk of developing strokes than men. And prior history of strokes or heart attacks. So if you have a prior history of a stroke or a heart attack, you are automatically at a higher risk of developing a stroke. So these are non-modifiable things that you can't necessarily change. All right. So modifiable, the things that you can change. High blood pressure. So high blood pressure. If you have high blood pressure, it kind of puts you at an increased risk of developing strokes. So it's important for you to take your blood pressure properly, like your doctor prescribed it, to manage your blood pressure. Maybe do some routine checks where you're actually taking your blood pressure each day to make sure that your blood pressure medication is continually working and your blood pressure is kind of within a healthy range that is agreed upon between you and your doctor. Smoking. Smoking causes damage to the small blood vessels in your heart and your brain, all over your body. Diabetes, all of that excess blood sugar going on in your body causes damage into your blood vessels and things. So it puts you at an increased risk. So if you're taking your medication and managing this disease process well, that can kind of help to lower your risk. Okay. Diet. If you're eating a diet high in cholesterol and fats and sodium, All of that is just, it just puts extra damage on your blood vessels and in your body. It's hard on your body. So if you can lower your sodium intake, lower your cholesterol, lower the fats, that can decrease your risk of having a stroke. Physical inactivity, if you're not exercising enough, that puts you at a higher risk. So getting exercise, it gets everything moving. It gets the heart pumping. It gets the blood pumping. It gets your blood flowing through your blood vessels. It keeps everything kind of clear. It keeps you strong, your heart and your lungs and stuff strong. That can decrease your risk of having stroke. Obesity, if you have more fat and things around your organs, more fat and stuff on your body has to work a little bit harder to supply nutrients to it. So if you're overweight or anything, losing a few pounds could help decrease your chances of developing a stroke. Any type of artery disease or heart rhythm disorders, they put you at higher risk for developing a stroke. So just managing these conditions can help just with decreasing your risk of developing stroke. Okay, let's talk about some signs and symptoms of stroke. Like, what are some signs and symptoms? So some typical signs and symptoms are going to be face drooping, arm weakness, speech difficulties, sudden numbness in the face, arm, legs, maybe sudden confusion, trouble speaking or understanding speech, trouble seeing, and then even sudden trouble walking, dizziness, loss of balance, or a really sudden severe headache. So according to the American Heart Association, they have this cool little way to remember the symptoms for a stroke, and it's called FAST. Act fast, act fast. So the first one is FAST, F-A-S-T. I drew a little picture for it so it's easier to you to see. So FAST, act fast. The F is for face drooping. So face drooping. A is for arm weakness. S is for speech difficulty, difficult speech. And if they're experiencing these symptoms, any of them, especially suddenly, then T is for time to call 911. So that's an easy way for you can kind of remember just some of the symptoms of the stroke. And if somebody's experiencing, just call 911. To call 911, get them to the emergency room right away, because it's better to be safe than sorry. So just fast. Face drooping, A for arm weakness, S for speech difficulties, time to call 911. What does recovery look like? So recovery looks like, it's different for everybody. Everybody's recovery is different. But what I research is that the biggest thing, rehabilitation is the key to achieving your way to recovery. So being rehabilitation, whether that is speech therapy to help with speech and help with, eating, if they're eating, physical therapy, if someone has lost, had weakness on one side of their body, to regain that strength back, doing physical therapy with that. And then also medication therapy. Maybe they're continuing their medication therapy to help manage any type of existing medical conditions they have that contributed to the stroke, like uncontrolled high blood pressure or uncontrolled diabetes. Keeping those things in check can decrease your risk of having a risk of strokes. So that could be part of, your therapy, your rehabilitation is medication therapy. So these are just some things that kind of how recovery looks like. You take it one day at a time. Do your rehabilitation. You take it one day at a time, and you let your recovery come one day at a time. But if you just keep working to it, you never give up, you keep working to it to get you back to a place that you are happy with, Last thing, prevention methods. Take your medications as prescribed by your doctor to manage all of your health disorders. Quit smoking. Eat healthy, develop a healthy diet, nutrition, exercise, and go to your doctor to get your checkups regularly done, okay? Keep yourself healthy, keep your body healthy, know the signs of a stroke so that you are educated and aware if you see these things, and, can make a prompt decision, get people to the hospital or call 911 if it's yourself experiencing these symptoms. I hope this was educational for you. I had fun making this video and researching this information. Take care of yourselves, be healthy, be happy, and I hope this blessed you guys. Take care of yourselves. Be healthy, be happy, be blessed. And I'll see you on the next video, Education for the Patient. Bye.